Okay, we're going to look at the respiratory membrane now. This would be at the bottom of one of those alveolar sacs. Each lung contains about 1.5 million of these little grape-like sacs. And if we took them all and ironed them all out in both lungs, it would cover like an entire tennis court. So I think I told you that before, but that'll give you an idea of the surface area that you have per breath. If we look at the complete surface membrane, we've got a layer of surfactant produced by these type 2 pneumocytes, and then we've got the rest of the type 1 pneumocytes making the cellular wall that makes up the inner lining of your lung. And then since this is epithelial tissue, there's a basement membrane below it. And then there's a very thin interstitial space and another basement membrane, and then we've got the epithelial tissue of the capillary cells, and so then there's the red blood cells floating in between. Normally, you breathe in about 18 to 20 times a minute, and so the air is only in your lungs for a couple of seconds before it's gone. So you have got to get all the oxygen and carbon dioxide exchange possible in just those couple of seconds. So what will affect that is also going to affect the your blood oxygenation level. So I listed some things. This is not a comprehensive list, but just an idea of things that can affect your ability to get rid of carbon dioxide and to bring in oxygen. Obviously, we've done everything anatomically to make this the smallest possible space. We've got the flattest cells, and we only have one layer of them in both the capillary and in the respiratory cells themselves. So it's as small a space as possible. Why? Because if you remember all the way back in part one when we were talking about diffusion, one of the things that affects diffusion is distance. If I was standing at the front of a normal classroom and I opened up a big 55-gallon drum full of skunk oil, well, the first persons that would smell that would obviously be the closest. But then as time went on, it would diffuse throughout the room and everybody would get a chance to smell it, right? You don't have to move. The funk will come to you. And so distance is going to be one of those things that affects it because we've only got about 2 seconds to get this exchange. So if we add fluid in here, that's going to increase, see the air's up here, the air would then have to go over the fluid to get this way. So we're increasing the thickness. So something like pneumonia, which is mostly pus anyway, edema, that's when we're just building up fluid, would increase the thickness. Also, if we add mucus, the disease cystic fibrosis results in a thick mucus buildup inside the lungs. And so that will increase the thickness of the membrane and make respiration more difficult. Or we can affect the total surface area itself. I already drew a picture of what emphysema looked like. In that case, we're losing surface area because we're flattening out all of the alveolar sacs. But you can also have scar tissue that will reduce the usable lung. Tuberculosis causes tubercle formations inside the lung, and that takes up space. And the way asbestos works, asbestos is a mineral, like think of it like a rock. So you get these little asbestos particles inside your lungs. Well, you've got macrophages there that clear up particles out of your lungs anyway, things like dust, pollen, that kind of a deal. So they swallow this asbestos, but they can't do anything with it. It's a rock. It's the same thing if you swallowed a rock and it fell down into your stomach acid's going to sit there, but it's not going to digest a rock. Neither can the macrophage. So the macrophage ends up dying. And remember, we've got cells that specialize in identifying dead and dying cells. Those are the cytotoxic T cells. And as the macrophages begin to die and no longer express the MHC1 complex on their surface, the cytotoxic T cells come and spray them with things like perforin, and it kills the macrophage, but you get some collateral damage too. It's like, well, if you're going to drop a bomb on a building, even if you hit the building directly with the bomb, you're going to get some damage outside that building, right? So you end up sacrificing some of the surrounding pneumocytes. And as you get more and more asbestos particles, you sacrifice more and more of these pneumocytes and replace them with scar tissue. And so you start losing uh, the functional ability of your lungs to exchange oxygen and carbon dioxide. Anything that affects the respiratory rate, and this can go both ways, the autonomic nervous system is going to be under the direct control of your respiratory rate. And so it can speed it up if we need to increase the gas exchange, or it can slow it down. Now, if we damage that center is the respiratory centers in the brainstem. We're going to talk a lot more about that in a minute. Um, then you can have an involuntary slowing of that. An example could be something like a subdural hematoma. Those of you that know who Liam Neeson is, the actor, he was, and of course, as soon as I say that, I can picture him in a bunch of things, and I can't think the name of a single movie. Uh, he's in those one of the what I call the revenge movies that started way back in the 70s or so with Charles Bronson and Clint Eastwood, and there's always somebody that something's been done wrong to some friend of theirs, and they're going to go get even for it. So anyway, he was in several of those movies. Taken, there we go. Whew, finally, a couple of movies just like that. And he and his wife were skiing, and she ended up crashing and banging her head on a tree and started bleeding around the skull. Well, the skull doesn't expand. If I slam my elbow against something, my elbow can swell up if it needs to. But if you're bleeding inside your skull, there's really no place for your brain to go except one, and that's the great big hole in the bottom of the skull. Remember that big one, the foramen magnum? Well, right on the top part of the foramen magnum, let's shift it like this now, is your brain stem. And as the pressure increases inside the skull, it starts to shove the brain stem down into the foramen magnum. And the brain stem is where your respiratory center is. And so as you shove that down in there, you short circuit it more or less and stop breathing. And that's what happened to her. And she passed away from that very thing. Let's see. Also, any kind of a depressant, like, well, in the hospital, sometimes patients are accidentally over sedated. Yes, that background is the theme song to the show, and also currently the ringtone to my phone. um, Sometimes patients are over sedated, and so their respiratory rate falls to a dangerous level. And then things like alcohol and narcotics are also depressants and will slow your respiratory rate involuntarily and can affect your oxygenation levels. Obviously, anything blocking the respiratory pathway is going to prevent air from getting down here to be exchanged. So if you have a child that swallows one of those balloons that I warned you about, it can seal off the larynx and prevent air from ever getting there to begin with. Reduction of circulation in the capillaries, since what's moving these things around anyway is your heart. The heart's pumping and causing these red blood cells to flow. When you have a heart attack, the circulation, there's no pump working anymore. And so these red blood cells just begin to fall out of solution. You're not moving things through the respiratory membrane, and so you tend to start retaining a lot of carbon dioxide because you're not getting the movement that you normally would. Also, anything affecting the amount of environmental oxygen. Sometimes I find students are surprised to learn that the air that you're breathing in is 80% nitrogen. And nitrogen doesn't go into your blood at all. Nitrogen you breathe in, so it's here in the lungs, but it never diffuses over into the blood. So when you breathe out, it just goes right back out. The air is only about 18% oxygen. There are casinos that will blow oxygen in the air and increase that level up a percent or two. and you actually can feel a difference. I mean, there's a reason that they do that. They want you to be more alert. There's a misconception that casinos will give you strong drinks and try to get you drunk and stuff like that. They do not want to do that because you get drunk, you get sleepy, you go to bed. They want to keep you in there. So they do every trick in the book to do that. There's no windows in casinos. There's no clocks on the walls ever in a casino. They would like for you to lose track of time. They will give you all the caffeine you want for free. There are Coke vending machines and things like that, and you just bring your cup, and they are more than happy to supply the caffeine to keep you alert and gambling because the odds are in their favor, and the longer you gamble, the more likely they are to win. Um, they desensitize you by exchanging money for chips because if you're throwing a $20 bill down there, you're like, oh man, that's a 20. On the other hand, if it's just a chip and all the chips are the same size and everything, it's a desensitizing effect and it's easier for you to throw it down. Or now you just put it on a card and you put your card in a machine if you want to. And it's not like you have to take something out of your pocket every time and put it in the machine. If you did, you probably wouldn't do it as often. And I know that's a fact because I know that since that's how they make their money, they've done studies on that. So we know that's a safe bet. And there's only about 2% carbon dioxide. Now, while I've got these up there, let me point out two things. It is possible to shove nitrogen into your bloodstream. And the way to do that is to be under pressure. So if you go down in a mine, that will happen. If you are a diver, any of you scuba divers know that if you go past 33 feet or so, you've got enough pressure from the water above you to push the nitrogen into your bloodstream. Now, provided that you come back up slowly, the nitrogen will diffuse right back into your lungs and you'll blow it out. If you come up too quickly, it will just bubble up in whatever tissue or capillary it happens to be in at the time. That's called the bends. And it's called the bends because you're bent over in pain. And if it's a severe case, it will kill you because what will happen is it'll all basically come back into a gaseous state inside your blood vessels. And you know how when you shake up, let's say, a Coke can and you pop the top, that foam that comes out? Well, that's what happens to your blood. So if you can imagine your blood turning to that foam stuff, you got to think that that's not going to go well for you. And it does not. And another thing that nitrogen can do, by the way, if you're breathing just normal atmospheric air instead of some type of a mixture like a trimix or something, and you go much past, say, 110 feet, then the nitrogen can begin to affect your brain. It's called nitrogen narcosis. So you're down there about 120 feet, and you look over and you think you see the little mermaid over there. And everybody knows that if you kiss a mermaid, you can breathe underwater. And so you take your respirator out, and you know, they find you a few days later floating down there with a smile on your face. Um, Also, people, I've been asked before, why have we got so much nitrogen in the air? Why not more oxygen? Well, there's a real good reason for that. If the air was, say, 100% oxygen, the first time lightning struck, the earth would burn up. Oxygen feeds flames like crazy, and NASA learned this one the hard way. They used to have the atmosphere inside the space capsules pure oxygen. And unfortunately, they were training the very first Apollo crew, and they were still on the ground. They were training, but they had the capsule sealed up, and there was a spark in there, and it killed all three astronauts because it was like a blowtorch in there. Before they could get them out, they basically were incinerated. So we learned that one. Also, think about this too. If you put somebody on oxygen, how could a doctor put you on oxygen if you were already breathing 100% oxygen? Right? So not only do you have to order the oxygen, but you order the percentage. So if you're scripting out oxygen for a patient, you have to say what percentage you want it, how you want it delivered. You know, do you want the little cannula thing in the nose? Do you want 40% oxygen, 80% oxygen? You can script 100% oxygen for the right circumstance. And having said that, I can tell you that probably 98% of the time, no matter what issue you have, oxygen is a fantastic thing to do. If you're having a heart attack, give them oxygen. If you're having a stroke, give them oxygen. I mean, it just works again and again and again. It's just that last 2% will kill you. So that is why you have to have a prescription to get oxygen, by the way. But remember, it's flammable. So, about once a year, some poor dude over at the VA is on oxygen and decides to sneak out and have a smoke. And that is a extremely bad idea because if that uh, cigarette tip hits that pure oxygen flow, well, like I said, you've got a blowtorch going on. It also might interest you to know, and by the way, this will be a test question, so I'll put it in red and I'll put a star by it, that the number one respiratory stimulant, the thing that excites your brain the most into speeding up your respiratory rate, is a buildup of carbon dioxide, not a depletion of oxygen, which is why if you are inside a garage with a running car and more of your hemoglobin gets tied up with carbon monoxide, you are not you're not aware of being oxygen starved. I mean, your body is, and it's automatically trying to pick up your respiratory rate. But as far as your conscious centers are concerned, you don't feel like you are suffocating because your conscious centers are monitoring your carbon dioxide buildup. That's why if you hold your breath, if you dive underwater and you hold your breath, as the carbon dioxide levels build up, you are going to have a stronger and stronger urge to breathe. Consciously, you're going to be aware that there's a serious problem there, and you're going to want to take a breath. And so, what I want to look at next is any of these things that cause a reduction in gas exchange are going to cause a buildup of carbon dioxide. And that is going to influence what our blood pH is because of our body's ability to use the respiratory system to help regulate pH. But if you stop it from doing so, it will affect pH. And I'll show you what I mean in just a second.